Hello guys, good evening everyone. So we are back with our Fundus walk at 5. So shall we start something new today? Again, we're going to take a look at the fundus. As you can see here, you can see the optic disc, and this optic disc somehow doesn't look normal. Do you see that? Is it normal to you? Does it look normal to you? Okay, this fundus doesn't look normal, or in fact, this optic disc doesn't look normal to you. Why doesn't it look normal? I'm sorry guys for all that is happening. Okay, so this optic disc doesn't look normal to you. What is abnormal about this optic disc? Can someone tell me? Yes, very good, beta. Yes, there are new vessels that you can see on this optic disc. Can you see this optic disc? And 1 second. Can you see this optic disc? And there are so many new vessels here on the surface. Yes, very good. So this is neovascularization of the disc. Yes, can you see the NVD? There's so many new vessels here and around the disc. So what is the most likely diagnosis? So how do we define NVD? How do we define NVD? So when you see new vessels on the disc and 1 DD area around the disc. See, 1 DD is 1 disc diameter is 1.5 millimeter. So when you see it on the disc or 1.5 millimeter area around the disc, that outer circle. So if you see new vessels anywhere of this in this area, then you call it neovascularization of disc. Yes, very good. Palli, no? I'm sorry, what's your name? Very good, beta. So this is neovascularization of disc because I see a lot of new vessels, and beyond that also I see new vessels because you've seen me showing you a lot of fundus images till date, and none of them had these kind of new vessels. Did you see this kind of new vessels in the other fundus pictures that we have seen so far? No, right? So this is NVD, and NVD means what is your diagnosis. NVD is a finding, right? So NVD is our clinical finding. So what is our diagnosis here? Our diagnosis would be proliferative diabetic retinopathy. Okay. So proliferative diabetic retinopathy, you'll get NVD, you get neovascularization beyond this area, beyond this outer circle area. That is going to be called NVE. Excuse me. NVE, that is neovascularization elsewhere on the retina. So diagnosis in this case is proliferative diabetic retinopathy. So when you see these nice fine new vessels, okay, so fine new vessels, these are these fine red arborizing pattern, that is your new vessels. So it's very simple for you to identify in your exam, because in your exam they'll give you classic florid NVDs. They're not going to give you one stub of new vessel. They're going to give you pictures like this. Is this clear? It's a very short walk. It's going to be just 5 minutes, and 5 minutes is NVD clear to you, proliferative diabetic retinopathy. And what is the management? The moment you see a patient like this, you have to immediately treat. Yes. So the moment you see PDR, you're going to treat. So we do pan-retinal photocoagulation, and these days we also give an adjunct of intravitreal anti-VEGF. Yes, very good, beta. Very good. Sorry, I've not got your name right. Very good. Yes, photocoagulation. Yes, pan-retinal photocoagulation. That is your PRP. So what are the lasers that we use for doing PRP? Very commonly, we used to use this argon green laser. So you can use an argon green laser. You can use a diode laser. You can use double frequency ND-YAG laser. Okay, so argon green laser can be used for your PRP because all these are photocoagulative lasers. Then yes, very good. You can use diode laser. Who's this? Yeah, very good. So argon green, diode laser, double frequency, ND-YAG laser. So all these can be used for doing a PRP or pan-retinal photocoagulation. Yes, adjunct treatment, you can give an intravitreal anti-VEGF injection as well. So that is your PDR. Why? Because I see neovascularization. Neovascularization is the hallmark of proliferative diabetic retinopathy. So here I do see it on the disc and 1DD area around the disc, and beyond that also I see some new vessels. So I see NVE. So my diagnosis is proliferative diabetic retinopathy. All right. So short and sweet. So our fundus walk is over. All right. So I hope this image is clear for you, and I will post a question for you in a little while so that you all can answer from what you have learned. All right. So is it clear to everyone? This PDR is very, very simple because now you have a hang of how a fundus looks like, and now you know how a new vessel on the fundus looks like. Yes. Is it clear to everyone? Just got a bad throat. Yes, clear? Clear everyone? So we'll wind up and then I will post a question for you which you can do it for practice. All right. See you guys.